Hi, I'm Mari Edlin with the Digital Health Summit, and here's my guest today is Pat Salber from The Doctor Weighs In. So I know you did your panel on consumerism and on-demand, different devices and digital technology. Tell me a little bit about how consumerism has become so important in the healthcare industry.
Sure, well, it's actually been a long time coming. If you think back to the advent of the chronic care model, where having an informed patient who participated in their care was really one of the foundational elements. That was what, 20 years ago? But now we do have patients who are empowered because they're interested in being engaged in their care, but we also have so many tools that allow them to facilitate them being engaged in their care. So I think it's been all of those things that have helped to move the model away from what some doctors say was the golden age of medicine, when we were in charge of everything, to what we have now, where it's really patient, at least patient as a partner, if not the patient in the driver's seat.
So you spoke about on-demand technology. Tell me what you mean by that.
Well, to me, on-demand technology takes a lot of form, but it really means that I'm putting my patient hat on now, which I can do with my broken shoulder. It means that I can get the care that I want, when I want, how I want to consume it, whether I want to get it in person, whether I want to get it via video, via a telephone call, via texting, however I want to get it. That's what I mean by on-demand. And whether it's synchronous, that is the typical, I go in and see you and we have a conversation real time, or asynchronous, where I send an email to my doctor and 2 hours later I get the answer. I want to choose, I want to be in control, I want to fit that into my life. That's on-demand care.
Because this is so different than what has come before, how are physicians reacting to this?
Well, that's an excellent question. So I think there's two things. One is docs need a couple of things to be comfortable with this, because remember, our model as physicians is we kind of see you when we're ready to see you. And I have all my crutches, I have my EHR, I have my references that I can get to. I have a lot of crutches that help me to provide the care to you. So if we're going to do distance on-demand care, I need to have the same kind of support system. And I actually think we're getting there. We have lots of ways in which people can have the medical record in front of them now, whether it's an EHR or a tool that we saw today, blue button powered app by Humetrics that allows a patient to have their entire medical record and send it to their doctor. And then Hippocrates, another person on my panel, who has developed tools that can make information, right, that I need as a doctor to take care of you, available to me real time. So I think we're building that infrastructure, and people are getting more comfortable with being able to deliver that kind of care.
Is that what you've meant in your panel about going rogue? These kinds of things you're describing right now, or are you referring to something else?
Yeah, I'm not responsible for going rogue, but it could be what they meant.
So what are some of the challenges that health plans and other healthcare organizations face in terms of adopting this kind of technology?
Well, I think first of all they have to have a will, right? And let's talk about health plans first of all. Is anything that's outside of the realm of the way they always do business means that you have that difficult change to make. You have to build some infrastructure. You have to convince people all the way up the ladder that you want to make this investment, and you want to make sure that it's not going to cost you more than the way you're delivering care now. And from the provider point of view, it's really all about workflow. So how am I going to do on-demand care and still take care of my full panel of patients? How do those details work out? And I think that there's some really smart people who are thinking about that now and trying to make that possible.
We've just run out of time, but thank you. So this is Pat Salber from The Doctor Weighs In, and I'm Mari Edlin from the Digital Health Summit.